Welcome to Stimulus Wealth Today. Millions of Americans rely on Supplemental Security Income as a lifeline to cover their basic living needs. SSI was created to support older adults, people with disabilities, and individuals who have little or no income, giving them a chance to live with dignity. Over the years, the benefits have been adjusted slowly, often not keeping pace with inflation or the rising costs of housing, food, and healthcare. For many recipients, the monthly checks they receive are their only source of consistent income, making every dollar essential for survival. Recent updates about a possible increase in monthly benefits, ranging between $337 and $537, have brought hope and relief to those who depend on these payments. The proposed raise is significant because it directly targets the financial struggles faced by SSI beneficiaries. Most recipients live far below the poverty line, and with rent, groceries, and medical bills steadily increasing, their limited budgets often force them to make difficult choices. Some skip meals to afford prescriptions, while others put off important doctor visits to pay utilities. Adding hundreds of dollars per month would not only ease these struggles, but could also improve the overall quality of life for millions of households. For seniors who rely on SSI alongside modest Social Security benefits, this raise could mean stability in a time when the cost of living continues to climb. The increase also has the potential to reduce reliance on community food banks, local charities, and emergency housing assistance programs. By raising the monthly payments from the current levels to a higher and more sustainable amount, families and individuals could experience more independence. A monthly increase of $337 could help cover groceries for an entire month for one person, while $537 might pay for both utilities and medical copays. This type of direct support can have ripple effects, but also local economies, since most of the money will be spent immediately within communities. Advocates for the raise argue that the current SSI structure has remained outdated for too long. The federal benefit rate has not been adequately adjusted to reflect modern living costs, leaving millions struggling in silence. They point out that SSI recipients are among the most vulnerable populations in the country, and that failure to update the system contributes to cycles of poverty and hardship. The proposed monthly raise is viewed not just as a financial adjustment, but as a step toward fairness and recognition of the dignity of those who rely on the program. For younger recipients with disabilities, this change could mean greater independence and less financial anxiety. Many face unique challenges that prevent them from holding steady jobs, and SSI is often their only safety net. A more substantial monthly payment would allow them to access better housing, healthier food, and essential services that are often out of reach. For seniors, the raise could ease the burden of fixed incomes and the fear of outliving their savings. Many older adults find themselves unable to cover Medicare premiums, prescription costs, or transportation to appointments, and an increase in SSI could bridge those gaps. The update also addresses long-standing concerns about how benefit amounts interact with inflation. Over the past decade, inflation has eroded the purchasing power of fixed benefits, leaving many recipients worse off than before, with prices for groceries, rent, and healthcare spiking in recent years. By raising SSI checks by a few $100s each month, the new adjustment could restore balance and give people the financial cushion they desperately need. It also signals a recognition by policymakers that leaving vulnerable populations behind has lasting social and economic consequences. Supporters note that the psychological benefits of the raise should not be overlooked. Constant financial stress leads to anxiety, depression, and declining health outcomes. Knowing that more money will arrive consistently each month can bring peace of mind and stability. Instead of worrying daily about whether they can afford food or medication, recipients could focus on their health, relationships, and personal goals. For parents of children with disabilities, this change could also relieve pressure, as it would provide more resources for care, therapy, and educational support. Economically, the increase could stimulate consumer spending at the local level. SSI recipients typically spend their entire benefits on necessities, meaning the money circulates quickly within their communities. Grocery stores, pharmacies, landlords, and transportation services all benefit when individuals have more to spend. This, in turn, strengthens small businesses and generates tax revenue, creating a cycle of economic stability. Critics who worry about the cost of raising benefits often overlook the fact that investing in people's basic needs has far-reaching positive effects for the broader economy. The debate around the raise has also highlighted the importance of updating other rules related to SSI. Many advocates argue that asset limits and income restrictions tied to eligibility need to be modernized as well. While the monthly raise itself is a huge step forward, these additional reforms could make the program more efficient and accessible. For example, allowing recipients to save more money without risking their benefits would encourage financial stability and self-sufficiency. Combined with the increase in monthly payments, these reforms could bring SSI closer to its original purpose of ensuring a basic standard of living for all recipients. Recipients themselves have expressed hope and gratitude at the possibility of seeing higher checks. For many, the difference between $337 and $537 a month is life-changing. It could mean finally affording healthier meals, keeping up with rent without fear of eviction, or paying off lingering medical debt. Real stories from across the country highlight how even modest increases in income can transform daily life for people on tight budgets. This raise has the potential to lift millions out of the most severe forms of poverty, granting them more stability and dignity. If implemented, the raise would demonstrate a strong commitment to protecting vulnerable Americans during uncertain economic times. As the cost of living continues to rise, ensuring that SSI payments keep pace is critical to maintaining fairness and security. By raising monthly benefits, the system acknowledges the struggles that recipients face and takes action to address them. It is more than a financial adjustment. It is a promise that society will not abandon its most vulnerable members. The difference between scraping by and living with security often comes down to these payments, and the raise could be the change that allows millions to breathe easier. Disclaimer: the information presented in this content is for general, informational, and educational purposes only. It should not be taken as official government policy, legal advice, or financial guidance. While efforts have been made to provide accurate and up-to-date details, Social Security and Supplemental Security Income (SSI) benefits are subject to change based on federal regulations, government updates, and individual eligibility. Viewers and readers are encouraged to verify details directly through official sources such as the Social Security Administration (SSA) and consult with qualified professionals for personal financial or legal advice. This content does not guarantee benefits, amounts, or approval.